wanted to briefly explain and introduce our specific practice, Dayton Interventional Radiology. It's somewhat of a unique practice in that all we do is interventional work. As many physicians know interventional radiologists, we are usually traditionally a part of a radiology group in the setting of a hospital. But many of the procedures that we offer are technically complex and really require a clinical setting where we need to see a patient beforehand, explain what we're going to do. Sometimes we make up a game plan as to what needs to happen, what procedure, what imaging modality is best for the patient. As a radiologist, we're very skilled in understanding what modalities are used for what types of different pathology. And then making an appropriate treatment plan, or in many cases an appropriate referral. We have a full-fledged office structure, clinic, where we see patients just like any other primary care doctor or any other subspecialist. And we have a large staff, over 30 people with medical assistants, nursing staff, certified nurse anesthetists for our procedures, vascular technologists. Currently, we have an outpatient clinic here in Kettering. We have an office setting in Springfield and one in Troy. And we're looking at different other models and different other smaller communities to be able to outreach patients. Now, I would say 90% of our work comes from primary care doctors who are sending us patients under the umbrella of back pain and leg pain. And really what we're doing with these patients is we're offering treatment modalities that have traditionally maybe not been offered to these patients. These are patients who are kind of falling through the cracks. They have vague symptoms, leg pain, weakness, back pain, they're not really surgical candidates. They're not really getting better with medical pain management or medical management. And there are potential opportunities for us to offer some of our procedures for definitive medical treatment. In 9 out of 10 cases, we're going to solve their problem. And what we're really focused on is making sure that we don't send that patient back to that primary care doctor without solving the problem. Because we know that by the time a primary care doctor is sending a patient to an interventional radiologist, they're usually basically out of options for that patient. Our biggest issue for us is just getting our information out. A lot of people, a lot of physicians don't really realize all the different things that an interventional radiologist does. It's just one of those things that the subspecialists know that we can do certain procedures that are pertaining to their subspecialty. But in a given day, each doctor does anywhere between 7 to 15 procedures, and we may encounter 7 to 10 different subspecialists in a day dealing with their certain types of patients. I would say to our subspecialists, friends who are sending us patients, that we're very dedicated to our clinical practice. We see patients before and we see patients after. We're very interested in knowing exactly what's happening with these patients. We're dedicated to outcomes-based medicine, where we're tracking quantifiably whether these patients are getting better. We want to make sure that appropriate follow-up is being done and making appropriate referrals when necessary, utilizing the appropriate studies. For our primary care doctors, our message would be that interventional radiology is much more than just radiology. We're a group of clinical doctors who are dedicated to taking care of patients and solving problems as general as leg pain or back pain. And this is something that traditionally just hasn't been known, and it's not one of those subspecialties that has a high risk profile. We simply are not doing those types of invasive procedures. So that's our message to the primary care doctor, that in simple, it's so much more than a bunch of radiology guys who are doing biopsies in the hospital. We're dedicated to taking care of these patients from A through Z.